thank you all for taking the time to join our virtual town hall. We'll continue to welcome people to the town hall, but we'll get started promptly because we have a lot to cover here, and this is an unusual occasion for us, but we are thrilled today. And I want to just begin as the board chair at Sacred Heart Greenwich by thanking our new head of school and my fellow board members and the COVID committee members of the special committee of the board that we formed immediately when the COVID-19 virus set upon us. And I want to particularly thank Dr. Vermund and Dr. Crystal Pollitt from the Yale School of Public Health for working with us over the course of our work here to get everyone prepared to return back to campus safely. And it's really been an eye-opening experience as an institution to really see how Sacred Heart Greenwich has so adequately prepared for this important moment of return to campus. Institutionally, we spent nearly $500,000, and we'll talk a little bit about where that investment has gone and to and through the campus. And so I'm going to turn it over to Meg, but I just really wanted to express on behalf of the board our appreciation to all of the faculty, staff, Dr. Vermund and his team from the Yale School of Public Health for really helping guide us with science and evidence-based information that we can then, we have then put to work on campus. So over to you, Meg.
Thank you. I think it's appropriate, given where we are, to just start with a brief prayer. And I'm just going to excerpt from Pope Francis's prayer to us in May. That was the 5th anniversary of Laudato Si. So we will begin. Loving God, creator of heaven and earth and all that is in them, you created us in your image and made us stewards of your creation. Open our minds and touch our hearts that we may attend to your gift of creation. Be present to those in need in these trying times, especially the poorest and those at risk of being left behind. Transform our fear and feelings of isolation into hope and fraternity, that we may experience a true conversion of the heart. Help us to show creative solidarity in addressing the consequences of this global pandemic. Make us courageous to embrace the changes that are needed in search of the common good. Now more than ever, may we feel that we are all interconnected and interdependent. In your son's name, amen. I think in our history, the battle cry of courage and confidence in our foundress has probably never felt more real. We have an incredible amount of confidence in this team who has guided us from Yale, and our own maintenance team, and what the faculty have done, what our families have given us in terms of their important questions. And we're excited to join you this afternoon in what was our delayed town hall due to the power outage. So we really appreciate all those who have given us questions. We'll try to weave the answers of those questions in as we hear from several different presenters today. And at the end of our presentations, we will have Liz Dennison guide us through some more questions that are coming in on the chat. So if you've just joined us and you haven't submitted a question ahead of time, you certainly feel free to submit a question in the chat. What we want to emphasize today is a scientific background of what we have taken advantage of since June when our Yale team visited us. And we want to look specifically at what's been done with the infrastructure of the school. We want you to also have more information around the context of where the virus is in Connecticut, what are best practices around keeping our students ages 3 to 18 safe, and to give us a sense of what we might look forward to as we return back to a safe campus. Of course, my goal is every girl, every day, but we want to make sure that we are providing the healthiest and safest environment for each of your daughters to learn and to be full into her activities as we think about back to school. So a new face for your students and our families will be our new school nurse. And before we hear from our Yale experts, I just want to introduce you to Mrs. Heather Elkin, who has joined us and is also getting ready to take advantage of our brand new health and wellness center that is nearly complete. So I'll let Heather introduce herself and say a little bit more.
Thank you, Mrs. Fraser. Good afternoon, parents. I am Heather Elkin. I started here at Sacred Heart right around the beginning of June. I bring with me 16 years of school nurse experience, 32 years of nursing experience, and most of it in pediatrics, maybe a few years at the beginning with adults. But my true love is children, and I bring that with me foremost. I came into a school at the beginning of the process of increasing health and safety for the students, and I have just been amazed at the way this COVID committee and all of the people involved have built the new health and wellness environment here at Sacred Heart. I will be joined by a second nurse in September. Her name is Amy Burke. She brings with her also years of school nurse experience. And I have an assistant in the health office, Tanya Johnson, who will be helping a lot with the Magnus portal and other administrative things going on in that area. I have been honored to help restructure the old nurse's office into a beautiful health and wellness suite. The old nurse's office is now adjoining with a classroom on one side, and it has been completely redone to promote health and wellness for girls in all different areas of their age and their well-being at the time. I hope you will be able to eventually stop by and see my beautiful suite. And I always laugh when I say I hope to see your daughters, which I really don't hope to see your daughters in the nurse's suite, but I would love to get to know them at any time. Thank you for welcoming me here, and I will answer more questions towards the end. Thank you.
Great, thank you so much, Heather. And I hope one of the themes that shines through this town hall and through our communications through the summer is truly the concept of partnership. We're looking for families to feel that they are working with us through these challenging times. And again, as Kathleen O'Connor said, we cannot be more appreciative of the partnership that we have benefited from with the Yale School of Public Health. Tackling these complicated issues has given us an opportunity to do many upgrades in the buildings that have been thought about for a while. And again, our maintenance team has worked tirelessly all summer, and we received many fabulous recommendations well ahead of what was being talked about in the news from Dr. Crystal Pollitt. So I'd like to have her kick off and speak a bit about what we have done in terms of our HVAC systems, what we have done in terms of considering the health and safety of our airflow on campus. And we will let her take the floor and guide us through her expertise. Thank you, Dr. Pollitt.
Introduction. So I had the pleasure of visiting the Sacred Heart Greenwich campus in June, and then speaking with a number of the staff and specifically the maintenance staff over the course of the summer, developing a reopening plan. So we went through each one of these indoor spaces across the school campus, and we discussed the typical activities in each of these spaces, from the science labs, libraries, to music rooms and dining halls. And then we discussed multiple prevalent routes of disease transmission, and then strategies to reduce risk of infection. So this included use of masks, hand hygiene, and also physical distancing in all the spaces. So in addition to these more common risk reduction techniques, we also considered approaches that address airborne transmission. This transmission route refers to aerosols that can be generated from numerous respiratory activities. This includes heavy breathing, coughing, talking, singing, playing wind and brass instruments. They can all generate a plume of aerosols that potentially contain infectious viral material. So to reduce the risk of airborne transmission, we discussed numerous opportunities for the students to be outdoors, and also the indoor air quality of each of the school buildings. So this was a considerable undertaking given the different types of buildings that you have on campus. The schools made numerous facility enhancements to facilitate more time outdoors for the girls, and also improve indoor air quality through the building HVAC systems, and also supplemental air cleaners in classrooms. So I'll go through some of the specific ventilation related improvements that really focus on 4 key areas: increasing use of outdoor air, high ventilation rates, enhanced filtration, and use of flush cycles. So the first, focusing on increased use of outdoor air. Increasing the outdoor air supply to indoor spaces eliminates recirculation of viral material in buildings. And this is really an effective effective strategy for risk reduction. So pre-COVID, buildings on campus used 25% outdoor air, and outdoor air, the remainder was recirculated within school buildings. There have been numerous controls that have been installed on the HVAC systems across campus to accommodate a minimum of 50% outdoor air in most of the buildings, and some classrooms will even benefit from 100% outdoor air. Enhanced filtration. Filters within an HVAC system can be used as a first line of defense for removing virus-laden aerosol from any recirculated air. HVAC equipment in buildings across campus were upgraded to MER 15 filters, and these filters will allow for 90% of aerosol from the airstream to be removed on each pass through the filter. So beyond simply cleaning changing the system filter is also critical to ensure that the filters are maintained. The schools installed controls to continuously monitor the status of the filters, and the maintenance servicing schedule has also been increased to every month and a half from the quarterly schedule that was used pre-COVID. So there's been also additional focus on increasing ventilation rates. Increasing the number of air changes for each room will allow for faster removal of airborne viral material. And the amount of ventilation that's necessary for each room space is dependent on its size, the number of students in that space, and also the type of activities that they're doing. The ventilation rates in each space on campus were considered by the facilities team, and any space that was deemed to benefit from supplemental ventilation had portable air purifier units added to it. 30 smaller air purifier units have been installed in offices and small instruction rooms, and additional larger 30 filtration units have also been installed for use in larger spaces. Flush cycles will also be implemented during the school day. Improvements have been made to the building management system to control the HVAC air handling units in buildings across campus, and this is going to allow for regular flush cycles of 100% outdoor air during the day to be run. Numerous risk reduction strategies have been implemented across campus in these 4 categories that I've described, and the combination of the implemented control techniques have been tailored for each one of the specific spaces, taking into account the characteristics of the building, from the Stewart building to the science building, the number of students and teachers that will be in these spaces, and also the type of activities that the girls will be doing. The strategy that the schools used with the layered risk reduction approach will allow for maximal disease control. So with that, I'll turn it over to Dr. Vermont.
Thanks, Dr. Pollitt. We really appreciate all your input on the engineering side of this equation. I'm a pediatrician and an infectious disease epidemiologist, so I've been working with the school on strategies to try to follow the big ticket items for risk reduction. Number 1 is maximizing mask use, and there's a whole behavioral agenda there. Small children are not used to wearing a mask. Some of them may be perfectly willing to use masks, and others of them may have to be cajoled or motivated, educated, and the like. The older folks are maybe aware of why masks are good, but adolescents may rebel and they may not be so keen to wear them. So we've talked about all sorts of strategies to try to maximize mask use, not require it where it's not necessary or helpful, give so-called mask breaks, and we've been looking at types of masks, and decisions have been made to purchase school masks, which have been very thoughtful. The second category, of course, is physical distancing. This is a challenge when you have a classroom that seats 20, but with physical distancing, it only seats 13. But the school has thought through very carefully the overflow rooms, the notion of having 7 students on Zoom and 13 in the classroom, and rotating those students through the class on the subsequent day, so that everybody is sort of in class 4 days a week and on Zoom 1 day a week or some such. And looking at the eating areas, we're deploying the old gymnasium for surge space, tents that are going to be used for outdoor activities, strategies to keep things like sports and drama and music and choral and art all safe as possible. We've been going through these systematically. We're also looking at hand hygiene, bathroom hygiene, food hygiene, surface hygiene, and I've been impressed by the revisions that have been made. We're evolving the school to be able to use an individual sort of container to fill up with water, rather than using the sort of the fountain with the proximate face to the fountain, and a lot of other practical measures to maximize hygiene, including the strategic use of plexiglass to create barriers, as well as decompressing the classrooms. And then, of course, everything about air quality that Dr. Pollitt has been highlighting. She happens to be an expert in indoor air quality and has done very elegant research in this space, so we couldn't have asked for a better consultant in that arena. And of course, limiting crowds. The governor is guiding us with his experts, including some of my colleagues at the Yale School of Public Health, and we're going to be following state guidelines, and we're going to be trying to keep crowd dynamics to the safest possible level. A lot of talk about testing, and we are absolutely keen to have gateway testing for any family that might have had a holiday in a higher risk state. I think there are 31 states on the governor's list of quarantine, and we would like people to quarantine when they come back, and any child and family who's been in a higher risk state, we'd very much like to see that negative test before the child comes back into the classroom. And no harm in them doing their schoolwork at home for 14 days or 10 days if they test positive. And that will try to start the school year in a virus-free space. Now, the questions have arisen, why don't we demand testing for everybody in the school? Well, the reason that that is not very cost efficient is because the background incidence rates are very low in Westchester County and Fairfield County at the present time. And we would do thousands and thousands of tests just to get no positives. We've done 2,300 tests of returning students to Yale, and we've had 1 positive. So we expect we'll have more next week, because more of our students coming from overseas and from out of state are coming in just right now. So we're expecting that we might have a few more than we did in the first tranche. But the first tranche of positives overrepresented students coming from this region. People who were planning on living off campus came in to get apartments, and we had extremely low rates, which is great, which is fantastic news. We're in a state where, although we struggled 12 weeks ago, and we're a top 3 state in the country in terms of coronavirus rates, now we're a bottom 3 in the country for coronavirus rates. So we've learned something, and we have had, I would say, more discipline on the policy side and on the social responsibility side than some of our sister states who were keen to open up, and opened up well before it was advisable to do so, and now they've had their second wave, and we've all seen it on the evening news and read it in the newspapers. But we feel that the fact that we do have these very low rates enables us to start school in the state of Connecticut in a way that gives us a lot more confidence. And we are more than happy for any family to test the child before coming to school, but it's been judged that it really is mandated only for those families coming from the high-risk states. Happy to answer other questions. There's a whole list of them here that you've been sending in, and I can just dive in for a few more minutes until Meg gives me the hook. There's been a question about face shields. And a face shield is the kind of thing that we want a dentist or an optometrist or an ICU nurse. Those are the people who need the mask and the face shield, because what we're talking about is an extremely close proximity for them to do their work. And in close proximity to people who may be carriers or who are known cases. And that's where the face shield comes in. Face shield can also be helpful in selected classroom environments. For example, if a language instructor needs to enunciate with the lips to be able to show someone how to pronounce the French or the Chinese or whatever word, Spanish word, then perhaps a face shield with 12-foot distancing might be a practical alternative. There are also masks that actually are transparent in the center, and that may be an even more satisfactory way of handling it. But we don't see face shields as something that is likely to be a major tool in the school. Now, let's say there's a 3-year-old who, for whatever reason, is utterly panicked by a mask and perfectly happy to have the Minnie Mouse face shield logo. Well, that might be a reasonable thing for that child until they can be coaxed into a mask. So we may use it in very specialized circumstances. Another question is about gloves. If someone has a serious eczema problem on their hands, such that there are a lot of crypts and crevices in the hands, then gloves are a very prudent and reasonable thing. But persons who have sort of standard hands, is there such thing, can easily keep themselves clean with hand hygiene, with 20-second soap and water. Now, keep in mind that 20 seconds is singing happy birthday to you twice. So it's longer than you might think. And a lot of people, do it for 10 seconds, think they've done it for 20 seconds. So happy birthday to you, twice, that's 20 seconds. And people need to be taught how to, this is not hand washing. This is hand washing. The full breadth of hand washing. So that can be taught. We intend to teach it to all our children in the school, including the older ones. And then you should take a tour of the school, and see all of the hand sanitizer venues. They've been able to get a lot more than I thought they would, because there's a shortage now of these, but they jumped on it in June and got enough hand sanitizers. They're all over the school. So we're making it as easy as possible for the children to hand sanitize. So no, I don't think gloves are going to add anything other than the individuals who really have an eczema problem. We don't want the vents to have the masks to have vents in them. A vent is a very specialized mask, which is useful in the environment where a healthcare worker is protecting themselves from a patient. And that's the only purpose of the mask, because the healthcare worker is actually expelling the aerosol through the vent. And that's not what we're looking for here. We want teachers, students, staff alike to have protection from the mask, because it's the double mask. The fact that Meg's got a mask and I've got a mask and we're talking to each other, that double masking is hugely beneficial in terms of each other's safety. So neither of us wants to have a vent where my aerosols would go right into her mask, or vice versa. So no vents on masks. That is unadvisable. Flu shots. So thank you. The influenza is a coronavirus-like disease, and we have it every year, and it kills 10,000 to 50,000 Americans every single year. And it's a little different from coronavirus because the very old and the very young are at the highest risk. So in the case of coronavirus, we have good news for you, which is that 45% of the American population is under the age of 35. And 0.75% of the deaths from coronavirus are under the age of 35. So in the population of young people who represent almost half the American population, considerably less than 1% of the mortality is in that group. So for reasons we still fully don't understand, children are comparatively spared from the point of view of severity of coronavirus. So that's good news for all of us worried parents. At the same time, children can acquire the infection. They can be a nidus of infection to others. And it's also highly disruptive for Heather's operation to be evaluating a whole lot of flu cases in the middle of our coronavirus year. So I beg you, all of you, get your flu shot this year of all years. All the adults in the household, all the children in the household, all the human beings in the household should be vaccinated against flu this year. Do that favor to your health office of Sacred Heart School, because that will be fewer false alarms where Heather has no way of distinguishing this child with a flu compared to a child with coronavirus, because the syndromes look exceedingly similar. And the fewer flu cases we deliver to her office, the better she can keep our girls safe here at Sacred Heart. So I really strongly urge you to encourage flu vaccine among your friends. It's just a little protein fragment. It doesn't give anybody the flu. All the myths out there are false. It'll give you a sore arm at worst. And beyond that, there really are from the conventional flu vaccine, the side effect rates are 1 in 3 million or something. So I think that it would be a great contribution. And get the flu vaccine as soon as it's available, probably be available in about October, November range. That's usually when we have this year's supply. There's a question about why is it better to be outside? So outdoor air, it's a dilutional phenomenon. So a car is a small box. A classroom is a larger box. Like your den in your home is also a larger box. And outdoors is a very, very, very large box, not much of a box at all. So you have tremendous dispersal of air particles, aerosols, and droplets in an outdoor environment. So it is safer outdoors. And Crystal highlighted a minute ago how the pulling in of outdoor air into indoor spaces can help freshen the air and keep it safe. So that's why migrating some of our school activities outdoors, there's serious conversation about choir practice being outdoors and having the kids, 12 foot, 15 feet separated and singing outdoors. The risk of that is minimal. But if you have them singing within a small box like this classroom, and they are projecting their aerosols out to the classroom, now even a good HVAC system, it'll take a little while to clear that classroom of the aerosols. So doing those sorts of things outdoors makes a lot of sense. There are questions about the difference in populations within the school. We have the preschool, we have the lower school, the upper school. We've got every imaginable age group from 3 to 18. And all of them can get coronavirus. All of them can transmit coronavirus. All of them can get sick from coronavirus. The good news is the illnesses from coronavirus in children are far more benign. Some of you have heard about the Kawasaki-like disease. It's an inflammatory disease. The really good news with that is how rare it is, and we have yet to lose a child from it. And because of Kawasaki disease, which was discovered 30 years ago, we actually know how to treat it. So, so far so good. And that's such a rare side effect that it's plausible that we'll go through the whole coronavirus season and not have a single child who's seriously ill who has to be hospitalized, for example, for any reason. That is very plausible given the rates. But each of those children can cause a transmission cycle within the school, highly disruptive to the educational enterprise, because now Heather's sending them home by droves because of all the need for quarantining of exposed children. And she doesn't want to do that. She wants your girls to be getting a proper education. And then the other part of it is transmission to people at home. So some of you are in 3-generation, maybe even 4-generation households. So you've got children, parents, and grandparents. And the grandparents are going to be my age. I'm 66. And, I know that I have what we call immune senescence, but the aging of my immune system, I am at higher risk than those of you who are in your 30s and 40s, and certainly a higher risk than the folks who are in their teens. And so I know I'm at risk. I still come, do my work, but I'm very fastidious about physical distancing, mask use, hand hygiene, outdoor activity, small crowds, the big 5. And I think I can keep myself safe through a cautious and conservative lifestyle. And you're going to have to pivot at home. And a vulnerable individual in your household may have to actually change their behavior and may have to forego the hugs and intimacies with the smaller children, especially if they're symptomatic or in any way ill. And the notion of being more cautious and having grandma be physically distanced and having a grandpa wear a mask in certain circumstances. So thinking of the child as a potential nidus of transmission to the elderly individual or the vulnerable individual is not a bad way to think, because it's true. And if you can do that without compromising family dynamics too severely, then I think we can keep our mental health and also keep our vulnerable members of our families safe. There's a whole slew of other questions, but I know we want to go to other issues, so maybe we'll take a break there.
Well, Dr. Berman, thank you so much. I think we've hit on several significant topics, but I also know that we have other questions that Elizabeth Dennison, our athletic director, has been nice enough to be monitoring in our chat today, and some last minute submissions. And also there may be some questions that relate to other topics, including the academic schedule or looking forward a little bit. So I'll defer to Liz, and she'll integrate your questions and perhaps guide them to a member of our team who might be best positioned to answer that. Liz, I turn it over to you.
Great, thank you, Meg. We'll get started on some questions that are in the same vein of what Dr. Vermund was just speaking about. So we'll start here with a question for Nurse Elkin regarding our flow charts that we shared with the community. How is close contact defined in those charts in terms of who would have to stay home from school? So for example, in scenario B, how are we determining what close contact is if there is a case at school?
The true definition of close contact, thank you, Liz, is within 6 feet for longer than 15 minutes. So there's 2 pieces to the definition of close contact. That gives us pause to think while we're active within the school community that short amounts of time close to one another does not necessitate the definition of close contact. For example, if you're using the girls' room, washing your hands, coming right back out and going back to class, that falls in less than a 15-minute time frame, even though you may be less than 6 feet apart. So there's 2 pieces to the close contact definition there. The rest of the close contact idea is part of contact tracing. And as we identify a positive case of COVID-19 or somebody who was near someone with a positive case, that filtration system down in identifying those close contacts will be done through the contact tracers here at Sacred Heart Greenwich with the assistance of the Department of Health.
And Heather, could you speak a little more about the importance of our relationship with the Department of Health? And we've had some questions here about what will determine, those types of situations where someone is diagnosed or a potential positive case, and how the Department of Health may guide us in those areas.
All area labs that are running COVID-19 testing report their positive cases to the Department of Health. They have to, it's a mandate. Once that positive case is identified, the Department of Health begins the contact tracing process. And as they interview that positive case, if it becomes known that that student is here at Sacred Heart or within the close contact circle of a student here at Sacred Heart, I will be notified by the Department of Health. I have a very close relationship with their second in charge or their head nurse there at the Department of Health. We actually just spoke this morning, and not about COVID-19 actually, but she's very accessible, and we hope to further that relationship going forward. They also ask us to give them a call at least once a week with updates from within our community on any reportable disease factors, including flu, measles, any of those kind of things, not just COVID-19. It will be a very strong partnership, I believe.
So this question is for Dr. Vermund. Could you speak a little bit to the rapid COVID tests that are just starting to come out more and more, and how we may or may not want to utilize those moving forward?
So there are really three types of tests. One is an antigen test, and the antigen test is looking for the immunological evidence of the virus infection. And the antigen test, I said immunologic, I should have said virological evidence. So the antigen test is not as sensitive as the PCR test. The antigen test is a great test if somebody's got symptoms. And you do an antigen test and you can get a result very quickly and very cheaply, and it's positive and it confirms coronavirus rather than flu or the common cold or respiratory syncytial virus or a whole host of other respiratory viruses that are especially common in the wintertime. So an antigen test can be very helpful if somebody's got a symptom. You test them with the antigen test and test positive, it's coronavirus. However, it's got a lot of false negatives in the asymptomatic group or the pre-symptomatic group. And from a prevention point of view, we're trying to find these asymptomatic individuals. That's the whole point of testing people coming from high incidence states before they start school, because they may be completely asymptomatic, especially kids who are asymptomatic at higher rates than adults are. So to find them and prevent them from joining the school community, having them at home for 10 days on Zoom, then they rejoin when they're no longer infectious. That's the whole point. So there have been some recent breakthroughs in PCR. You may have read about one called Saliva Direct that I'm proud to say comes from our school, Yale School of Public Health, our colleagues Nate Grubaugh and Ann Wiley. And this is going to make the PCR test a lot simpler and a lot cheaper and a lot quicker. So we're, as quickly as we can, getting letters of authorization that we're required to provide given the approval we have from the FDA, and trying to assist groups to being able to do that. So stay tuned. In a few months, we may have a protocol that helps a child produce saliva, because saliva is not the same as mucus, is not the same as sputum. And if you can have pure saliva, it's a much simpler material to work with in the lab than sputum or mucus. So that's too much detail. But the point is that we're looking at saliva and then simplifying the PCR. So that really is a game changer, and we're trying to be as helpful as we can to as many labs as we can to do that. But the PCR that's done across the street by the pediatrician is nasopharyngeal, which is the standard approach now. And he's able to get 24-hour results, which is remarkable. We're having a lot of complaints from some of the commercial labs giving results in 3-4 days, which is ridiculous. The whole point of testing is to get a quick result, so you can act on it. Then some of you have heard of the antibody test. Well, the antibody test says I had coronavirus, I generated antibodies against coronavirus, so that shows that I recovered from coronavirus. And that's of tremendous interest to somebody like me as an epidemiologist, but it's not actionable. That basically means that person had coronavirus and doesn't have it now. So the antibody test is not being used very much except in epidemiologic studies. But it's really that PCR test that is the most helpful at the present time.
Great, thank you. Our next two questions are a little bit more to do with arrival and departure and transportation. So in two parts, the first part for Dr. Vermund, what precautions would you suggest for those that are going to take the bus, because that's their only method of transportation? And then Linda, hopefully you can address some of the adjustments we've made in our drop-off and staggered pickup to enable that to be smoother in the morning. So Dr. Vermund, anything with the bus and how families should handle that if their students are riding the bus to school?
As I understand it, the Greenwich buses are being decompressed somewhat because a lot of parents are choosing to adjust their own work schedules to be able to drop the children off in their personal vehicles. And a decompressed bus with fewer kids on it is obviously preferable, because then the kids can sit with some spacing. You hate to think of a crowded bus and a kid going 40 minutes to school. That is not optimal by any way, shape, or form. And with a little education of the bus drivers, they may be more open to having windows open, for example, having a little more airflow in the bus. So having the kids sitting a little bit apart, they can still talk to their friends, but having them a little apart, wearing masks, opening windows, those would be 3 quick strategies to think about safety on a bus. The school itself has already decompressed its arrival schedule and staggered its arrival schedule to decompress the entryways to the school to have many fewer students, but I'm not the best person to talk about that.
So I can chime in on that. Hello, everybody. We're going to have multiple, and Dr. Vermund has spoken about a staggered arrival schedule, and we will have multiple entry points for different segments of the school using, again, we have we're very fortunate in having such a large campus and so many entries and exits, and faculty will have duties to be monitoring the entrances and exits to the school so that we can maintain the big 5, which is the social distancing, the masks, and the entrance to the school in the morning. No earlier entries before 7:30, again, because we're asking that everybody participate in the Magnus Health app and report their health status every morning, again, for the public health of our community.
Thanks, Linda. Dr. Pollitt, we have some questions here about bathrooms and both density within the bathrooms and airflow when flushing toilets and things like that. Is there anything you could speak to address some of those concerns about how the virus may spread and what we've done to mitigate that?
Of course. So density within the restrooms, that was addressed before in terms of prolonged close contact. So we don't expect any student to stay within the restrooms for any extended period of time. They'll be wearing masks while they're within these spaces, so that prolonged contact is not achieved within the space. With regard to toilet flushing, so yes, there is aerosol that's released when flushing a toilet. However, the amount of aerosol that's released is very small in the terms of a picoliter, so incredibly tiny. If you were to speak without a mask on and say hello 3 times, you'd be generating about the same amount, if not more, aerosol, to give you a comparison. With regard to ventilation within the restroom spaces, all of them have been checked in terms of their exhaust capabilities. That's being operated on a maximum. So there is sufficient ventilation in all these spaces as well.
Great, thank you. So we have some questions on the difference between cleaning, sanitizing, and deep cleaning, and how we've adjusted some of our staffing and protocols around ensuring those high-touch spaces are clean. So perhaps Nurse Elkin and Tony could address, and maybe our experts from Yale, what we have in place in terms of cleaning, and how we've addressed that to ensure that touching certain spaces are not a way of transmitting the disease. And maybe also in that, how much the disease is actually transmitted by things like a piece of paper or an assignment that they may turn into a faculty member.
So Liz, let me speak to what we've done from a staffing standpoint. So what we've done is we basically hired additional staffing. We had 1 porter, 1 custodian. We now hired 3 more. So we'll have 4 custodians in school, during school, in effect, assigned to each building. And they, throughout the day, will be going and doing the deep cleaning or the high touch point cleaning. In the evenings, we've changed our, upgraded our cleaning service. They will be doing a very deep cleaning every night. And on the outside, we've redeployed our outside staff to, in effect, deal with those tent areas and playground areas, athletic areas, and outdoor bathrooms. So staff has been significantly enhanced and redeployed.
Great, thank you. Nurse Elkin, would you speak a little bit to just our cleaning discussions we've had and sort of the impact on turning in a piece of paper, or should students be bringing their own cleaning supplies, or is the school prepared with what we need in that regard?
Are prepared in what we need in that regard, and we would highly recommend that students not be bringing in their own cleaning supplies. Part of the reason for that is cleaning during the day. We will be providing the teachers cleaning products that are safe to be used with children in the environment. It's very important with the large percentage of children with asthma here at Sacred Heart Greenwich that we not be using products that could potentially trigger a reaction, a respiratory reaction in an asthmatic child or a child that has a sensitivity to strong smell. The cleaning products that we'll be using are more of an alcohol wipe-based product or a product that is a hydrogen peroxide-based spray that can be used with children present. Any of the disinfecting cleaning times or the deep cleaning times will be done when children are not present in the classroom. We have to be very, very careful about that. I'll let Dr. Ramoon touch on the handing in of papers because he had some very clear ideas on that earlier in our walkthrough. I think he'll speak to that better than I would.
Well, I don't have all the answers, but I do know of the studies that suggest that plastic and stainless steel can harbor coronavirus for about 3 days without cleaning. And paper and cardboard can harbor coronavirus for considerably less time, about a day. And when one thinks about the dynamics of paper, one is not slobbering all over a piece of paper. One is holding it with one's hand in a part and handing it to a teacher. And the receipt of those the teacher can be clever and just, set your paper on my desk, and there can be a pile there. and it can be taken home and reviewed either the same day or the next day. I go back to Dr. Pollitt's comment. The volume of coronavirus in pinching a piece of paper and turning it in and then pinching it again and receiving it is so minuscule that I would rather we worry about the big issues in the school and not so much the small ones. Now, if I'm a teacher and I'm doing all the papers from my class and I'm finished doing that, I might be doing some hand hygiene on the side there from time to time. I think that would be very prudent and very thoughtful. And the student is going to receive the paper from the teacher in response. Now, keep in mind that if we're doing college prep and we're talking about 10th, 11th, 12th graders, we need to go online. There's no reason to be exchanging any papers at all. Turn in your term paper by sending it up to the online system. Send in an assignment online. There's just a lot of stuff that we can help protect Mother Earth by not killing as many trees and just using the electronics. And that's how college is. I haven't touched a piece of paper in years. So, you know, the reality is I'm doing everything electronically. The students are doing everything electronically. Now that may be a little more challenging for the 6-year-olds, and we're trying to teach them cursive, and you know, there's a lot of things we're trying to do with paper and pencil. So I'm not talking about that. But our upper school, how many papers do we need to be handling and passing around?
Great.
Crystal, do you agree with me? You're the environmental health expert.
No, I agree completely. So the stability, our SARS-CoV-2 on paper is about 24 hours. So simply just letting them be for overnight is likely sufficient.
Great, thank you. We've had a number of questions about lunch and recess, and I know that we won't get into specifics necessarily by division, but generally speaking, perhaps Nurse Elkin and our experts could just talk a little bit about best practices when eating. We will be utilizing outdoor space and our cafeteria with plexiglass for those times. Are those a good opportunity for mask breaks during recess, or potentially Nurse Elkin can address that? And then eating, obviously the mask will come off, and how we're going to be working with students to make sure that's done safely.
Sure. It varies by school a little bit, so I'll try not to be too specific to school at this point, but overall, masks, of course, will come off during the lunchtime. To back up just a little bit, however, I'm a huge proponent of hand washing before eating. We will definitely be encouraging very, very good hand washing before the practice of eating, snack or lunch. We have built in scheduled times to do that safely within the lower school, upper school, middle school. We've added additional outdoor sink systems so that when students are outside and they're ready to eat their lunch outside, or they're playing on the playground outside, they have accessibility to washing their hands very quickly. Along with hand sanitizer, I think ladies will be encouraged to be practicing hand hygiene very, very frequently, but before meals, I would very much like them to actually do 20-second good hand washing, and we will encourage that very highly. In the lower school, lunch will be delivered to the classroom, therefore the students will remain in their classroom to eat. They could go outside and eat, but the lunch will be there, so girls will wash their hands, sit back down, take off their mask, and we have several different ideas of places to put their mask, then either in a sandwich container that we're providing or a bag system that we're providing, so that we will teach them the proper way to put their mask down while they're taking it off to eat, and then they will be eating, sitting down at their desk. We do need to be cautious also of food allergies in the environment. Our lower school has several students with rather severe food allergies. So we will also be practicing cleaning of the environment afterwards with the teachers, and all the surfaces inside will be cleaned off immediately after eating and once everything is put away. In the middle school, upper school environment, our lunchroom has been completely transformed with plexiglass, and we will be making sure that the numbers in that environment are much less by utilizing the tents outside and the outside environment. Also a grab and go environment where the girls will pick up their lunch and go to a specific area to sit down and eat, mask off, and again, we will go through that teaching during the orientation period. So I think that was a little general overview, but you want to add anything, Mrs. Fraser?
No, I think that's fine. I think many of the students will have a feel for how this will work in practice when they come to campus, and that's one of the many reasons why the orientation sessions are short, but will give the students a sense of this still being their home with enhanced protocols and signage to remind them, and a philosophy that we're all learning. So this is going to be a gentle process to all practice together and to give them opportunities to be leaders within the school and take that social responsibility and personal responsibility we want them to take as Sacred Heart girls anyway. So we hope that that comes through in the orientations.
Megs, speaking to that a little bit, we've had some questions about the idea of our social contract that we shared with families, and all of these great mitigation efforts and precautionary measures that we'll have in place at school, and the impact on activities and behavior outside of school. And could maybe you speak to this, and perhaps our experts from Yale as well, just the importance of what's happening outside of school and how that will impact the effectiveness of our measures inside school?
Absolutely. Again, I can't stress enough the concept of a positive partnership. I start as a teacher, as a head of school, believing in the best in the girls and the families. And we now more than ever need to think about our mission on and off the campus. You've heard A to Z of all of the different infrastructure changes, the signage, the thoughtfulness that's gone into getting this campus ready. All of that can be undermined if we don't take advantage of what we've learned about hand washing and consistent mask wearing, being careful about our social distancing, physical distancing, being mindful of the size of gatherings and density, being aware of others vulnerable in our community. So I just have to really encourage people to think about who we are as a community and to be exceedingly consistent in our behavior to the degree that we can, and that we will continue to support the girls and educate the girls and work with the families. Everyone's in a slightly different situation, and whether it's on-campus learning, which is our goal, or learning from home, every Sacred Heart girl will have an excellent academic year, but we need everyone to be consistent in following all of what we've heard to be the right science and the right social behavior. And I'll pass it over to Dr. Berman.
Well, I think you said it beautifully. The problems we're having in the college level and in young adults is not so much at the workplace, at the school, but in their social lives. And this is why bars are not open. What is it about a bar that encourages physical distancing or mask use? Nothing. And so bars, unregulated parties, even benign ones like a birthday party where people are simply not disciplined, they're not physically separating, they're not using masks, they're not using hand hygiene. This is where we've had the biggest trouble so far. And so regulating girls' actions outside of school is not so easy. We're only locum parentis when they're in school. The parents are the parents out of school. So we are looking to forge the same powerful alliance with parents that school teachers always forge, which is to try to build the character of our young people, both from within the school and outside. And the stakes are very high now, so we'd like parents to be helping manage social events. Can kids have parties outside of school? Sure they can. Physically distance, mask use, outdoors, you know, same principles that we've been talking about the whole hour. and have a smaller party. Just have a party of just a handful of people instead of a big party. So no, it's not going to be Studio 54, but it's going to be something that's completely lost on some of my younger parents who are on but it's not going to be party time as per kind of a stereotypic adolescent birthday party, but it'll be a smaller group, it'll be a more thoughtful group, it'll be a more measured group. And keep in mind, this is our coronavirus year. This is the year where classic public health strategies are absolutely critical. Next year, we hope we'll have new drugs. We hope we'll have vaccines. Next year, we may have coronavirus being treated more like influenza. But this year, all we've got is classic public health strategies. So this is the year where we need social discipline, for lack of a better term.
Great, thank you. I'm cognizant of the time as we're getting close to 4. I'll mention a couple of the questions that are still out there. Some are addressed in our FAQs on our website, and I know Meg will give a wrap up here. But the last question that we've gotten a number of times that I hope Meg and Nurse Elkin could address just generally is about the monitoring of certain thresholds that we'll use to assess a need to move to a hybrid environment or to a remote learning environment, and what we will be watching for as we hope to have every girl every day continue to come to school after September. So Heather and Meg, that would be the last question before we wrap up here.
You can take
No, I can help if you want.
You can help.
Sure.
Why don't I help? At Yale, we're using a variety of metrics. It has to do with the number of students who actually have to go into isolation because they're diagnosed as coronavirus cases, the number of students who have to go into quarantine, whether or not any faculty or staff have become seriously ill since they're more in the age group where they would be expected to become sicker. And we're looking at state metrics. You may have heard the cutoff of 3 new coronavirus cases per day per 100,000 population. And happily, the state of Connecticut is under 2. And one of the most favorable rates in the entire country. New York is also at a historic low compared to the last 16 weeks. So between New York and Connecticut, we're doing well. So the background context of what's going on in Fairfield and Westchester counties, that will count for a lot. The actual burden within the school, that we identify a case, we send that case home, we identify the contact, they go into quarantine, and we can wall it off, we may be able to continue functioning. But if we have 20 such cases, that may be highly disruptive and may be very complex. There's also the concept of shutting school down for just a week. And if the background circumstances are not unfavorable, if they're still favorable, the notion of then being able to open up a week, and it might even be we close down school for a week and have everybody tested that week. So there are all sorts of middle level measures between being fully open and being fully closed that one might be able to consider. And if it's any use, I mean, I'm right in the heart of this for Yale University, and I've been working with enough schools to see that what we're doing is not what the schools can do. But I'm happy to help you think that through further, to try to think about what kind of metrics one might want to see to keep school fully open, and then where one might want to step back school intensity for a little while to see what's going on. And keep in mind too that one could close a part of the school for a week and keep the rest of the school going. So there are many middle grounds that are very justifiable from a pediatric and epidemiologic point of view that I think we could consider.
I know everybody would like to hear an exact number, but we have to encourage everyone to think along flexible lines as we go forward with the coronavirus all of this fall. There may be times where we need to close down a certain group, whether that's a classroom or a cohort or a school for a small amount of time. While we do our contact tracing, we do anticipate contact tracing taking some time. So I do want parents to be aware that there may be a period of time that we need to do the contact tracing, and you may be contacted that your daughter's classroom is closed for a small period of time. That may extend. A lot of that will have to do with what the Department of Health advises us at that time. There will be so many factors taken into account as we decide how we fluidly move from in-person learning to remote learning, there's not going to be a single number, but a very, very careful consideration of all the factors in the equation every single time.
I think that's an excellent note to end on, and I want to emphasize that I will be working as a division head, as head of upper school, with the other two division heads, and Mrs. Vasu and Mrs. Elkin, to absolutely work with the teachers, that there is no more punitive measure, there's nobody getting ahead or behind because of missing school. We will be working together to make sure every girl is supported every day, whether she's here on campus, whether she's doing learning from home, whether she's waiting to hear through contact tracing. The trust that has to come from that is that we are truly all in this together. And I hope that you've heard in this hour, and you'll continue to hear from us, because Friday I'll work with the PA to have a follow-up for more granular questions or anything that still remains lingering in your mind, that there is so much that we can do as a community to keep ourselves safe. And if you're like me, the words of our foundress always, always ring true. Madeline Sophie once said, "Your example, even more than your words, will be an eloquent lesson to the world." What a better time to be an example of a community that's bound together with shared social and personal responsibility, that we're looking out for ourselves and looking out for others, that we're being flexible, consistent, sensitive, optimistic, and that we put our best foot forward and we adapt and adjust as we go. So I can't thank you enough. I can't thank our team from Yale for being true partners. Dr. Whitley in Birmingham joining us too. We have a board behind us, and together we will have a great back to school. I look forward to seeing you on Friday at the division coffees, if you can make that. There'll be a follow-up email to give you points of emphasis today, and I hope you have a wonderful rest of your day. Thank you so much.